Hi guys, welcome to Pathology. I'm Aliyeva. I'm going to deliver you lecture 4, part 1. The topic of our lecture is inflammation. Inflammation is a typical pathological process. It's a protective, adaptive reaction of the body to the action of any damaging factors. That means the main link of inflammation is tissue injury. We say inflammation is a complex response of the body developed during injury. And you see here the elements of this complex response: vascular reactions, the elements of connective tissue, blood cells, leukocytes, mast cells, macrophages, and fibroblasts, and all these are regulated by nerve system. The etiology, the reasons of inflammation, the factors that cause inflammation are called phlogogens. Phlogogens are divided in two groups, exogenous and endogenous. Exogenous phlogogens include mechanical factors, trauma, for example, accident, then physical, ionizing radiation, high and low temperature, maybe, the chemical, some poisons, and biological factors, viruses, bacteria, parasites, and others. By endogenous phlogogens, we mean some substances that are formed in the body during different pathologies. For example, the breakdown products of malignant tumors, the action of immune complexes, bile acids, breakdown products of the nitrogen compounds, for example, in uremic gastritis, and etc. All they are endogenous phlogogens which may cause the inflammation. There are 3 stages in pathogenesis of inflammation. The first is alteration, the second exudation and immigration, and third is proliferation. Any inflammatory process begins with alteration, cell damage. We distinguish primary and secondary alteration. The primary alteration is a result of direct damaging effect of the pathogenic factor. Here we observe change in the cell membrane, damage to mitochondria and lysosomes. At this stage of inflammation, damage to lysosomes is the great importance. We have talked about this in our previous lectures. The development of secondary alteration doesn't require the action of the phlogogenetic factor, since in secondary alteration, tissue damage develops as a result of action of the factors formed during primary alteration. And so during primary alteration, the process of glycolysis, lipolysis, proteolysis are accelerated. They lead to the physicochemical change in the inflamed tissue. The main change here is hyperosmia. This means the increasing of the osmotic pressure in tissue. Then hyperonchia, that means increasing of the oncotic pressure in tissue. Acidosis, and increasing of the concentration of the hydrogen ions, hyperionia. During primary and secondary alteration, inflammatory mediators are formed. Inflammatory mediators are biological active substances that cause the subsequent course of the inflammatory reaction. The mediators of inflammation are divided into humoral and cellular derived mediators. But by the time of their activation, they may be early and late. And at the point of their effect, they may be effective on the walls of the blood vessels and the activity of inflammatory cells. The mediators of the humoral origin include activated proteolytic system of the blood plasma, the complement system, the kinin system, coagulation, and fibrinolytic system. The main feature of this proteolytic system is the presence of the functional relationship between them. Activation of the one of these systems under the influence of specific factors leads to the activation of other systems, which triggers a chain of autocatalytic proteolytic reactions. The main source of the mediators of cellular origin are neutrophils, macrophages, eosinophils, mast cells, basophils, and platelets. The kallikrein-kinin system is activated under the influence of the Hageman factor, 12th factor of coagulation, you see in this scheme. The main effects of kinins. They dilate arterioles, they cause, and by this way they cause arterial hyperemia. They cause contraction of the endothelial cells, increase the permeability of venulus. Then they accelerate the proliferation of the fibroblasts and collagen synthesis. And at last they irritate nerve ends and cause severe pain. In this scheme, you also see the activation of the coagulation and fibrinolytic blood systems. As a result of activation of the coagulation and fibrinolytic system, the following inflammatory mediators are formed, you see here. The fibrinopeptides, they increase vascular permeability and activate leukocyte chemotaxis. Products of fibrin degradation, they are chemoattractants and they may increase the vascular permeability. Active proteases, the thrombin, plasmin, activate the kinin system and the complement system. We have talked about function of the complement system in our previous lectures, for example, in the lecture about the reactivity. You see here the main active components of this system. They are the C5A and C3A are mediators of acute inflammation, and they cause anaphylotoxis. They cause liberation of the histamine from muscles. Thus, they directly and by means of the histamine cause vasodilation, increase the permeability of capillaries. The component C5A of the complement system plays a role of the chemotaxis for neutrophils and also activates the metabolism of the arachidonic acid by the lipoxygenase pathway. And the next component, C3b, this component of the complement system is an opsonin. It facilitates immune adhesion and phagocytosis. And it was the C5bC9, this complex is called membrane attack complex that causes lysis of the microorganisms and cells. The next group, the cellular mediators, for example, histamine, serotonin, lysosomal enzymes, is a part of the cell granules they present inside of the cells. For example, lysosomal enzymes are released in the focus of the inflammation from granulocytes, monocytes, macrophages. They cause secondary alteration. The other part, prostaglandins, leukotrienes, the platelet activation factor, reactive oxygen species, nitric oxide, the cytokines is synthesis only after cell activation during inflammation. Histamine refers to the cellular type of the mediator and is produced by muscles during their degranulation. Factors causing degranulation of the muscles during the inflammation include you see in this slide, you see the degranulation of the muscles and they induced by antigen-antibody complex, C3A, C5 components of the complement system. Some types of cytokines, for example, interleukin-1, interleukin-8, and etc. Lysosomal proteases and direct effect of phlogogenic factor on muscles. All they induce the degranulation of these muscles. The main effect of histamine on the focus of inflammation, they dilate the arterioles, cause the arterial hyperemia. Due to the contraction of the endothelial cells, increases the vascular permeability of the venulus, and by irritating of the nerve ends, they cause pain. The effect of histamine on cells is realized through special receptors, H1 and H2 histamine receptors. The enzyme phospholipase A2 activated by an excess of intracellular calcium and causes the formation of arachidonic acid from the phospholipids of the cell membrane. There are two ways of the arachidonic acid metabolism: cyclooxygenase pathway and the lipoxygenase pathway. Cyclooxygenase pathway leads to the formation of the prostaglandin, thromboxane A2, and prostacyclin. Prostaglandin E2 causes vasodilation, pain, fever, increased vascular permeability, dilates the bronchi, and stimulates muscle degranulation. Thromboxane A2 is formed in the brain, spleen, lungs, platelets, and in inflammatory granuloma cells. Thromboxane A2 narrows arterioles, causes bronchospasm, platelet adhesion, and aggregation. Prostacyclin I2 is synthesized in vascular endothelial cells and dilates arterioles and bronchi, inhibits platelet aggregation, and enhances the anticoagulant effect of heparin. The next way is lipoxygenase pathway, you see here. During the metabolism of arachidonic acid along the lipoxygenase pathway, leukotrienes LTB4, LTC4, D4, E4 are formed. Leukotrienes are synthesized mainly in the white blood cells, platelets, and lung cells. And leukotriene C4, D4, and E4 are united under the general name, which calls slowly reacting substance of anaphylaxis. LTB4 is chemotoxic factor that causes neutrophil aggregation, and leukotriene C4, D4, E4 cause vasoconstriction, bronchospasm, and increased vascular wall permeability. Lipoxins, they are also metabolites of the arachidonic acid. Under influence of the 12 lipoxygenase, platelets form lipoxins. Lipoxins perform the following functions. They have anti-leukotriene effects. They inhibit chemotaxis and neutrophil adhesion, and they have the effect of vasodilation. Platelet activation factor, PAF, is formed under the influence of the phospholipase A2 from phospholipids of the neural membrane, basophils, monocytes, endothelial cells, mast cells, and platelets. The main effects of its action include the spasm of blood vessels and bronchi, for example, vasoconstriction, bronchoconstriction, increased permeability of venules. This effect 10,000 times stronger than the histamine effect of the increasing of the permeability. And platelet activation, acceleration of their aggregation, all they include this action. It should be noted that steroid and non-steroid anti-inflammatory drugs are used to block the metabolism of the arachidonic acid. Steroids cause transcription of the gene encoding the synthesis of lipocortin, this protein. Lipocortin are endogenous intracellular phospholipase A2 inhibitor. And the non-steroid anti-inflammatory drugs, for example, aspirin, indomethacin, ibuprofen, and etc., by inhibiting the cyclooxygenase enzyme, have an anti-inflammatory effect. And in this slide we see the effects of the cytokines. Cytokines are synthesized mainly by activated monocytes and macrophages, as well as neutrophils, lymphocytes, endothelial and other cells synthesize the cytokines. And cytokines are derived in two main groups: pro-inflammatory cytokines and anti-inflammatory cytokines. Pro-inflammatory cytokines include interleukin-1, interleukin-6, 8, the 12, 17 even, then the interferon gamma, the tumor necrosis factor alpha, colony-stimulating factor, chemokines, some, and others. And anti-inflammatory cytokines include interleukin-10, transforming growth factor beta, interferon alpha, beta, delta, and even interleukin-1 receptor, the inhibitor. Then interferon gamma is synthesized by T lymphocytes, and interleukin-1, tumor necrosis factor alpha, are synthesized mainly by activated macrophage. The local effect of the interleukin-1 and TNF-alpha is associated with their effect on endothelium, leukocytes, and fibroblasts. As the inflammatory process expands, deepening, the plasma levels of interleukin-1 and tumor necrosis factor alpha increase. At the same time, spreading with blood, They act on organs and tissues that have specific receptors for cytokines, primarily on the brain and bone marrow and liver. Cytokines alter the activity of these organs and tissue, and as a result, in response to local change, a general systemic reactions of the body occur, which called the reaction of the acute phase. This is manifested by the appearance of the number of change, and this change includes, for example, fever, increase in blood leukocyte count, leukocytosis, the synthesis of the acute phase proteins in the liver, for example, C-reactive protein, the ceruloplasmin, galactoglobulin, and others, and the anorexia, which means the loss of the appetite, activation of the hypothalamic pituitary adrenal endocrine system as a result of the concentration of the adrenocorticotropic hormone and cortisol in blood increase, and the synthesis of opioid peptides, beta-endorphin and other, all they increase, and at last hemodynamic effect, shock, may occur under influence of the large doses of these mediators. The second stage of inflammation is called exudation and immigration. Exudation means the passage of the protein-containing liquid portion of the blood through the vascular wall into the inflamed tissue. But before exudate formation, some vascular changes occur in inflamed tissue. These are, we will show these stages in the next slide. Here the change occurring in the vascular change in inflamed tissue. The brief spasm of the arterioles. It lasts from the 10-20 seconds to several minutes. Then the arterial hyperemia, which lasts 20-30 minutes, maximum up to 1 hour. The venous hyperemia, and it lasts stasis. From several hours to several days it lasts. And in initial stage of the inflammation, a brief spasm occurs. And spasm of arteries occur when a damaging agent acts on tissue as a result of excitation of the vasoconstrictive nerves and secretion of catecholamines. The short duration of the arterial spasm, in turn, is associated with the activation of the monoamine oxidase in the inflamed, in the damaged tissue, which breaks down catecholamines. The second stage of arterial hyperemia is the vascular reactions is arterial hyperemia, and the occurrence of arterial hyperemia is a result of the formation of mediators in the focus of the inflammation. At this stage, the vascular reactions, local signs of inflammation occur, the redness and fever. Then arterial hyperemia is replaced by venous hyperemia. Several mechanisms are involved in the development of the venous hyperemia, those associated with blood, with wall of the blood vessels, and extravascular mechanisms. The mechanisms associated with blood, the intravascular, include the marginal position of leukocytes, swelling of the red blood cells, the transition of the blood plasma to inflamed tissue, and blood clotting, increasing intravascular coagulation, and thrombosis as a result of activation of Hageman factor. The vascular wall factors are the edema of the endothelium, as a result of which the lumen of the small vessels narrows even more. Altered venulus lose their elasticity. The role of the extravascular factors in the occurrence of the venous hyperemia is that the edematous tissue, exerting external pressure on the venous and lymphatic vessels, narrows their lumen and prevents the outflow of the blood and lymph from the tissue. The pendulum-like blood movement during venous hyperemia is the reason of the pain, take a pulsating nature. Finally, the movement of the blood stops completely and stasis develops. At the stage of arterial hyperemia, due to dilation of the arterioles and increase in blood flow, intravascular hydrostatic pressure increases, and this causes the transition of the fluid from capillaries to tissue. This fluid, called transudate, is a plasma ultrafiltrate containing a small amount of proteins. At the stage of venous hyperemia, due to the contraction of the endothelial cells under influence of inflammatory mediators, the distance between endothelial cells increases and the permeability of the vascular wall increases. As a result, large molecular proteins exudation pass into the interstitial space. Then blood cells immigrate. This protein and cell-rich fluid is called exudate. As a result of exudation, the oncotic and osmotic pressures of the interstitial fluid rises even more, which leads to the accumulation of fluid in the extravascular space and the formation of edema, exudate. Exudate differs from transudate in a number of signs. The cellular composition of exudate depends on the type of the phloogenic factor. In the inflammation is caused by pathogenic microorganisms, staphylococcus, streptococcus, and others. The exudate content of the neutrophilic granulocytes prevails, and in inflammation caused by parasites, for example, helminths, the content of the eosinophils dominate. In chronic inflammation, for example, during tuberculosis, syphilis, the content of mononuclear cells, lymphocytes, monocytes increases in the exudate. Thus, exudate is a transition of the liquid part of the blood, electrolytes and protein from blood vessels to the focus of the inflammation. Exudation occurs as a result of the increase in vascular permeability in the microcirculatory system, increased colloid osmotic pressure in the inflamed tissue, and hydrostatic pressure in the venulus. The increasing of the vascular permeability is explained by the several mechanisms. The first mechanism is contraction of endothelial cells. The rises from the action of histamine, bradykinin, the leukotrienes, and other mediators. As a result of the binding of these mediators with specific receptors on the endothelial cell membrane, the actin and myosin microfilaments in the cytoplasm of these cells contract. The endothelial cells are rounded and pores formed between them expand. This process lasts short time, 15-30 minutes. Only endothelial cells of venulus undergo contraction. In the endothelial cells of the capillaries and arterioles, this process doesn't occur. The next mechanism is direct damage to the endothelial cells. As a result of necrosis of the endothelial cells, vascular permeability increases. This is observed mainly during burns, infection, and other diseases, inflammatory diseases. And the next is leukocyte-dependent damage to endothelial cells. Reactive oxygen species and lysosomal enzymes released from activated leukocytes cause damage to endothelial cells. And at last, the mechanism is associated with increasing of the acceleration of the transcytosis. Intracellular vesicles exposed to the vascular endothelial growth factor and other mediators accelerate the exit of fluid from vessels. Exudation followed by immigration of the white blood cells during inflammation, the second stage of inflammation. The following stages are distinguished in the exit of the leukocytes from the vessels into the extravascular spaces. The first called margination, marginal position of the leukocytes, then rolling. The next is adhesion, transmigration between endothelial cells, then chemotaxis of the leukocytes in the area of damage, and at last phagocytosis. Okay, this slide shows us the steps of the immigration of the leukocytes, and we will explain them step by step. The first is margination, marginal position, and then rolling. Normally, the blood cells circulate through the central part of the blood vessel, but in inflammation, as a result of increased permeability of vascular wall, the plasma is lost, and blood flow slows down. White blood cells separate from the central blood flow and approach to the vascular wall. And the margination, the marginal position of the leukocyte occur by this way. Then the white blood cells roll in the direction of the blood flow along the surface of endothelial layer. This process called rolling. Rolling occurs with the participation of adhesive molecules on the surface of the endothelial cells and leukocytes. These adhesive molecules are called selectins, and they have the corresponding ligands on the surface of the endothelial cells. The next step is adhesion, and then transmigration begins. Before the leukocytes pass through the endothelial layer and the basement membrane into the intravascular space, they tightly adhere to the surface of the endothelium. Adhesion occurs, and stable adhesion. Stable adhesion requires attachment of integrins on the surface of the leukocyte membrane. You see in the slide the members of these integrins. And the leukocyte membrane to the ligand on the surface of endothelial cells. Normally, integrins have a weak adhesive property. As a result of addition of the chemokines to the proteoglycans on the surface of the endothelial sites during the inflammation, integrins acquire a high adhesive ability. White blood cells then pass between endothelial cells. For example, PCAM1 CD, the 31st molecule, the receptor molecule on the surface of leukocytes and endothelial cells provides transmigration of the leukocytes. In this way, the leukocytes that cross the endothelial layer begin to secrete the enzymes such as elastase, collagenase, hyaluronidase, and they lysate, they do lysation of the basement membrane and exit through the vessel wall. White blood cells begin to pass from the vessels to the focus of the inflammation at the end of the stage of arterial hyperemia. There is a direct movement of the white blood cells that have passed through the basement membrane to the lesion, and this process called chemotaxis. This process is carried out through chemotaxic factors, chemotaxins. White blood cells immigration occurs in a certain sequence. At first, neutrophilic granulocytes immigrate to the site of the inflammation, to the focus of the inflammation. And immigration of the neutrophils begins 15-30 minutes after alteration. And within 4-6 hours, the content reach a maximum, and immigration process lasts approximately 6-24 hours. Neutrophils don't live for a long time in an acidic environment in the focus of the inflammation. After neutrophils, 24-48 hours after alteration, monocytes pass into the focus of the inflammation, then finally lymphocytes. This sequence of the leukocyte immigration is explained by the fact that adhesion molecules and chemotaxis factors specific for individual leukocytes form at different times. Phagocytosis is a process of active ingestion, neutralization, and lysis of the foreign particles, including microorganisms, by phagocytic cells. The following stages of phagocytosis are distinguished: chemotaxis, adhesion, engulfment, and intracellular digestion. Stage of the chemotaxis or approximation. Chemotaxis of the phagocytes occur under influence of chemotaxins. Chemotaxins are divided in two groups: endogenous and exogenous chemotaxins. The exogenous chemotaxins include bacterial lipopolysaccharides, products of splitting of the bacterial wall. Endogenous chemotaxins are, for example, the complement component of C5a, leukotriene B4, interleukin 8, even PAF, platelet activating factor. The next stage is the stage of the adhesion. At this stage, the phagocytes adhere to the object of the phagocytosis. Adhesion may occur without the participation of the receptor or through the receptor. Opsonins are the factors that contribute to the bonding of the bacteria and corpuscular antigen to the phagocytes. The absorption of the opsonins on the surface of the bacterial cells and antigens are called opsonization. IgG, immunoglobulin G, the complement component is C3b, colectins, C-reactive protein, fibronectin, and others are the main opsonins. And the stage of swallowing, the engulfment. This stage, the first phagocytes surrounded. In this stage, the phagocytes primarily surrounded by object of the phagocytosis with pseudopodia, and slows it and forms a phagosome. Inside the phagocyte, the phagosome binds to the lysosome and phagolysosome forms. Then stage of intracellular digestion. At this stage, through the bactericidal system of phagocytes, bacteria are destroyed. Intracellular cytolysis occur, carried out. And there are two bactericidal mechanisms in leukocytes are known: oxygen-dependent and oxygen-independent. And at the stage of proliferation, the third stage, final stage of the inflammation, reparative tissue regeneration occurs in the focus of the inflammation. At this stage, catabolic processes are gradually replaced by restorative processes. Various mediators of inflammation are neutralized and vascular permeability is restored. Migration of leukocytes is suspended, and the leukocytes that leave the vascular lumen in the extravascular space undergoing necrosis or apoptosis and die. At the same time, the macrophages begin to synthesize a number of factors that inhibit the inflammatory processes. For example, transforming growth factor beta, angiogenesis factor, vascular endothelial growth factor, and others, fibroblast growth factor beta, and others. After the neutralization of the phlogogenic factor, occurs the restriction of the area of the inflammation and its replacement with the new healthy tissue. Connective tissue cells, the polyblasts or the lymphoid cells, advanced CCS cells, and endothelial cells of small vessels, reticular cells of the lymph nodes begin to multiply. And with the differentiation of these cells, mature fibroblasts, fibrocytes, mast cells, plasma cells, and new capillaries are formed. Slides show us the outcome of the inflammatory process, and you see the outcome of acute and chronic inflammation are different. The outcome of the acute inflammation have the different various types. It may be a complete restoration of structure and function, then the scar tissue formation and transition of the acute to chronic form. And the outcome of the chronic inflammation, you see the development of the fibrosis. And in brief about the chronic inflammation is characterized by prolonged course, weeks, months, years, infiltration of mononuclear cells, and the formation of granulomas and fibrosed capsules, and development of necrosis in the center of the focus of the inflammation. Chronic inflammation can be primary and secondary. Sometimes inflammation from the beginning has a chronic cause, primary chronic inflammation, and in other cases it develops as a result of acute inflammation, secondary chronic inflammation. The causes of the primary chronic inflammation include the causative agent of certain infection. For example, it may be during tuberculosis, Mycobacterium of tuberculosis, the causative agent of lepra, the pale treponema, and others. And at last, long-term effects of harmful exogenous factors. For example, some solid particles, silicate, asbestosis, and the endogenous, increased plasma lipids, and even autoimmune diseases, for example, the rheumatoid arthritis combined by chronic inflammation. The pathogenesis of the chronic inflammation include incomplete phagocytosis. In this case, the phlogogenetic factor cannot be excreted from the body. Macrophages, lymphocytes, plasma cells, and eosinophils are the main cells of the chronic inflammation. The main stage in the pathogenesis of the chronic inflammation is prolonged activation of macrophages. Such activation occurs through the activation of the cytokines secreted from the sensibilized T lymphocytes, especially the interferon gamma, and bacterial endotoxins, a number of mediators formed in the acute inflammation. The main cells of the chronic inflammation also involve lymphocytes, plasma cells, and eosinophils. T lymphocytes are activated by interleukin 12, you see in this slide, which is synthesized by antigen presented cells, macrophage, dendritic cells. In this case, interferon gamma released from lymphocytes activate monocytes and macrophages. Macrophages in turn secrete cytokines such as interleukin-1, tumor necrosis factor alpha, activate other cells and lymphocytes. As a result, in the focus of the inflammation, to neutralize the damaging phlogogenetic factors, the macrophage and T cells activate each other. The granuloma is a morphological basic of the chronic inflammation, which is a multitude of the macrophages surrounded by lymphocytes and fibrous capsula. Macrophages altered by interferon gamma and sometimes called epithelioid histocytes due to the similarity to epithelial cells. Epithelioid histocytes connecting with each other form the giant cells, Langerhans cells. And the granulomous inflammation occurs during tuberculosis, leprosis, syphilis, sarcoidosis, and Crohn's disease. The signs of the inflammation, local and general signs of inflammation are known. If the influence of pathogenic factor is completely limited by vascular reactions, inflammatory mediators don't spread by blood and lymph from the damaged area throughout the body. Mainly local signs prevail. Local manifestation of inflammation include redness, rubor, the swelling, tumor, pain, dolor, fever, color, and impaired function, the functionalism. Rubor, redness, occur due to arterial hyperemia and arterialization of the venous blood. In arterial hyperemia, due to increase of velocity of the blood, the incoming oxygen does not completely pass into the tissue. As a result of this, part of oxygen passing into the venous system causes an increase in the content of the oxygenated hemoglobin in the venous blood. Tumor or swelling occurs because of development of arterial and venous hyperemia, dynamic the lymphatic insufficiency, exudation in the focus of inflammation. Then the dolor, pain, occurs as a result of effect of inflammatory mediators, histamine, serotonin, kinase, on sensitive nerve receptors, and due to the high concentration of the hydrogen ions, potassium ions, acidic metabolites, lactic acid, pyruvic acid, and etc. Color, the local temperature in the area of the inflammation occur as a result of increase in the blood flow and arterial hyperemia, and at last the loss of function, functionalism. Dysfunction of tissue and organs occur because of structural damage to the organs and tissue. The slide shows us the general signs of inflammation. The increasing of inflammatory process, mediators, especially cytokines, have crossed the barrier of the focus of inflammation, spread through the blood and lead throughout the body. These mediators, when combined with specific receptors in the target cells, alter the activity of corresponding organs and tissues, resulting in the common signs of the inflammation. The following are the common signs you see in the slide of inflammation. It includes fever, increasing of the body temperature, leukocytosis, increasing of the count of the white blood cells, then an increase in the content of the aqueous phase proteins, for example, C-reactive protein, then ceruloplasmin, haptoglobulin, and others, and increasing of ESR. Means increasing of the erythrocyte sedimentation rate, and others. In severe bacterial infections, for example in sepsis, excess increasing of the concentration of lipopolysaccharides and inflammatory mediators, as well as tumor necrotic factor, the interleukin-1, interleukin-6, and other cytokines observed. As a result, septic shock may develop. This is accompanied by disseminated intravascular coagulation, DIC, and of blood, and adult respiratory distress syndrome, hypoglycemia, hypotension. Thus, a low concentration of inflammatory mediators, you see in slide, leads to the development of only local manifestation of the inflammation. The average concentration of these mediators, along with the local manifestation, also the development of general manifestation occur, and a high concentration of these mediators may lead to the septic shock. In classification of the inflammation, there are several different types of inflammation are known, and according to the pathogenic, phlogistic agent, infections and non-infections inflammation are known. Then it may be specific and non-specific inflammation. In specific inflammation, along with general signs of the inflammation, the symptoms characteristic for this pathogen are they manifested. This observed during tuberculosis, for example, syphilis, lepra, anthrax, all they are specific types of inflammation. Non-specific inflammation refers to the inflammatory process resulting from the action of various factors, but they are similar in clinical science. And according to the vascular tissue reaction, we distinguish ulcerative, exudative, and proliferative inflammation. Ulcerative inflammation is characterized by predominance of the signs of damage. This type of inflammation is found mainly in parenchymal organs and tissues, for example, myocardial, liver, kidney damage, and therefore ulcerative inflammation is also called parenchymal inflammation. Exudative inflammation is characterized by predominance of the disturbance in the microcirculation, exudation, and immigration over the ulcerative and proliferative change processes. And depending on the composition of the exudate, catarrhal, serous, the fibrinose, hemorrhagic, purulent, petrificative, and mixed type of the inflammation are distinguished. In proliferative inflammation, proliferative processes prevail over the process of alteration and exudation. Proliferative inflammation is observed in chronic diseases, for example, tuberculosis, syphilis, rheumatism, and the others. And finally, in brief, about some principles of correction of the inflammatory processes. And the correction of inflammatory processes is carried out in accordance to the principles of etiologic, pathogenetic, cytogenetic, and symptomatic treatment. What does it mean, etiologic correction? Etiologic correction aimed at eliminating of the phlogistic factor from the body. For example, here we use antibiotics against the microorganisms. The pathogenetic correction here, this correction is carried out to order to block the mechanisms of the main mechanism of the inflammation. For example, here we want to suppress the process of exudation, the action of histamines, the decrease the vascular wall permeability, and for this we use antihistaminic preparation, steroid hormones, and others. Then the sonogenetic correction, these correction aim to activate regeneration tissue, their recovery. For example, we use a stimulation of the proliferative reactions, and the symptomatic corrections. These therapeutic measures are carried out eliminating of symptoms that occur during inflammation. For example, we may use here analgesics.
Fever, typical pathological process characterized by increasing of body temperature under influence of pyrogenic factors. What does it mean, pyrogenic substance? A biologically active substance causing increase of blood temperature are called the pyrogenic substance. The pyrogenic substance are divided into two groups: exogenous substance and endogenous substance. Exogenous substance or primary substance, for example, lipopolysaccharides of bacterial membrane, virus, and fungi. Endogenous pyrogenic substance, for example, interleukin-1, interleukin-6, interleukin-8, TNF-alpha, interferon gamma. They derived from granulocytes, macrophage, and etc. The exogenous pyrogenic substance stimulated of phagocytes, then formed of the endogenous pyrogenic substance. The endogenous pyrogenic substance are synthesized during infection disease. Endogenous and exogenous pyrogenic elements have their own characteristics. Endogenous pyrogens are formed in the blood of the animals 20 or 30 minutes later after the injection of the exogenous pyrogens element. The latent period of fever caused by exogenous pyrogen element depends on its dose and site of penetration into organism. Repeated administration of bacterial pyrogens element into the organism causes formation of tolerance against their action. To produce fever, higher doses are required, but endogenous pyrogens don't have latent period and tolerance. Mechanism of fever development. Temperature is regulated by the hypothalamus. The hypothalamus has an anterior portion and a posterior portion. The anterior portion of hypothalamus is involved in the heat losses. The posterior portion of hypothalamus is involved in the heat production. There are four groups of neurons: thermostat neurons and set point neurons, next center of heat production and center of heat losses. And thermostat neuron receives the temperature of the skin and internal organs and blood. If the thermostat temperature is low than set point temperature, heat loss center is excited. If the thermostat temperature is above than the point temperature, heat production center is excited. The set point takes the thermostat temperature as a low temperature. This time, heat production is increasing and heat loss is decreasing. Then temperature of organism increases. Pathogenesis of fever and primary pyrogens element influence in the organism, activate macrophage phage and phagocytes, secretion secondary pyrogens element, for example interleukin 1, 6 and etc. Then thermoregulatory center activate, prostaglandin is increasing, phosphodiesterase is decreasing, and cyclic adenosine monophosphate is increasing. Set point is activated, and heat production is increasing, and heat loss is decreasing. Finally, increasing temperature of body and form fever. Very interesting slide. I want to explain this slide. Influence in the organism, exogenous pyrogen element, for example infection factor, and activate macrophage and phagocytes, secretion endogenous pyrogen element, for example interleukin 1. Interleukin 1 influence to T lymphocyte, next B lymphocyte and hepatocyte and natural killer. If activate T lymphocyte, then proliferation of T lymphocyte and interleukin 2 production. If activated of B lymphocyte and proliferation of B cell and form plasma cell after product immunoglobulin from plasma cell. If activate hepatocytes, synthesis of protein of acute phase. Next, activated of natural killer cell, increasing of cytotoxic activity. Interleukin 1 influence in the center of thermoregulation or in hypothalamus, activation of cyclooxygenase, synthesis of prostaglandins, increase of cyclic adenosine monophosphate, increasing of heat production, and increasing of heat loss, finally form fever. There are 3 stages of fever, and first stage, second stage and third stage. First stage or stadium incremente, the study of increasing of body temperature, heat production is increasing, heat loss is decreasing. Second stage and or stadium fatigue, the stage of stable elevated temperature, the ratio of heat production to heat loss is established on a higher level. And third station or stadium decremente, the stage of decreasing of body temperature, heat loss is increased and predominate over heat production. Very interesting slide. I won't explain this slide. And the influence in the organism, exogenous pyrogen element, for example bacteria, virus, and activity macrophage, after macrophage and copper cells of the liver, secretion endogenous pyrogen element, for example interleukin 1 and etc. This element influence in the center of thermoregulatory center temperature, and change normal structure cell, disorders of membrane of the cell, and form arachidonic acid after form prostaglandin E2. Prostaglandin influence in the organism and change temperature of the body. As the first stage, the oxidation process increasing, the sympathadrenal system is activating, acute spasm of peripheral blood vessel, it is decreased of blood flow in the peripheral blood vessel. Then a decreasing temperature in peripheral part system. Then formed chills and shivering of muscle, increase in muscle tone and contraction of muscles, and appearance of goose flesh. Slowly, temperature is increasing. At the second stage, and there are dynamic equilibrium between heat production and heat loss, but the temperature on the higher level. And at the third stage, the temperature drops rapidly. This process is called crisis, and slowly this process is called lysis. If the temperature drops slowly, occurs vasodilation, showering, and increasing metabolism, and increasing ventilation, and if the temperature drops rapidly, and blood and rapidly, and occur peripheral vessel dilation, blood accumulation in peripheral vessels, and central nervous system doesn't take necessary blood. Acute collapse is vascular insufficiency, and in disorders metabolism, and in fever, carbohydrate metabolism is increased, possible developed of hyperglycemia, hyperketonemia, hyperketonuria are developed. Increased loss of nitrogen, occurs negative nitrogen balance. At the first stage of fever, diuresis is increased, and then decreases of blood volume, and at the second stage of fever, diuresis is decreasing, and aldosterone and blood volume is decreasing. Then secretion of aldosterone from adrenal system, and if increasing of aldosterone, and then sodium and natrium accumulation in body, and diuresis in decreasing. That's why at the second stage, diuresis is decreasing. At the third stage, diuresis is increasing, and 1 degree rise in temperature, accompanied by an increase of 8 and 10 beats of heart rate. Respiration is accelerated. Acute disorders acid and basic metabolism, pH decreasing, accumulation more acid element, secretion of digestion juice decreased, accumulation toxic element in the organism, and formed outer intoxication. And in the third stage, decreasing temperature is rapidly and gradually. In the rapidly from crisis, in the gradually or slowly, and from lysis temperature. Next, functional and biochemical indexes during fever. The indication vary throughout the fever. and pulse, arterial pressure, rate, respiratory, diuresis, acid-base balance, ketonemia, heat production, and heat loss change. In the first stage, pulse increasing, and second stage increasing too, and third stage don't change, and arterial pressure increasing at the first stage, and in the second and third stage decreasing. Rate respiratory in the first stage decreasing, in the third and second stage increasing. Diuresis in the first stage increasing in time, decreasing of blood volume, and aldosterone increasing, then natrium retention in body after increasing activity of antidiuretic hormone, and then water retention in body and form oliguria. And third stage, diuresis decreasing, and temperature decreasing is rapidly and gradually. And acid-basic balance in the first stage don't change. In the second stage, form alkalosis, and then form metabolic acidosis. The first time pH increasing after decreasing. In the third stage, and normalization acid-basic balance. Ketonemia, and change normal amount of ketone body. Heat production in the first stage increasing, heat production in the second stage increasing, in the third stage increasing, and heat loss in the first stage, heat loss decreasing, in the second stage increasing, and third stage increasing too. The type of fever depends on the elevated level and have several forms: subfebrile temperature, febrile temperature, and pyretic temperature, and hypertemperature. And subfebrile temperature increasing to 38 and 37 degree, and febrile temperature increasing 38 and 39 degree. Pyretic temperature is increasing to 39 and 41 degree, and hyper temperature is increasing to 41 degree and above. According to the character of the temperature curves, the following main form of fever are distinguished, and there are different form temperature curves, and febris continue, different between morning and evening temperature, not more than 1 degree. This process develop in abdominal typhoid, corpus pneumoniae, and other form febris remittance, and difference between morning and evening temperature, not more than 1 and 2 degree, and this temperature occurs abdominal typhoid, catarrhal pneumonia, and tuberculosis. Next, febris intermittence. The temperature attacks large differences of temperature, even dropping to the level that lower than normal. This temperature occurs in the tuberculosis, malaria, sepsis, in the liver diseases. Next, febris hectica. Differences between morning and evening temperature is 3 and 5 degree. This process develops in sepsis. Febris recurrent. Periods of hyporexia and non-hyporexia replaces each other. Replacing typhoid, develop in the replacing typhoid. Fever and hyperthermia differences. What means hyperthermia? Hyperthermia occurs when high temperature have a general effect on the body. Fever occurs when exogenous, next endogenous pyrogen substance have effect on the body. And hyperthermia have two stage, compensatory stage and decompensatory stage. And cause in the fever is pyrogen element. In the hyperthermia, increasing temperature of atmospheric air. Pathogenesis, elevation of function activity of set point in thermoregulatory center. In the hyperthermia, destroying of function of thermoregulatory center. Heat balance in the body. In the fever, difference change in different stage, and is a hyperthermia, increasing of heat emissions and fever-like states, physiological state, and under emotional and physical factor change normal temperature of body, change of nervous system, in the mental disorders, in the hysteria, if the organism take and drug element and medicine, and maybe example adrenaline, ephedrine, and several other drug, and endocrine disorders, increasing temperature of the body. In all these cases, the temperature rises, but there is no effect by pyrogenic substance. And malignant hyperthermia, very interesting slide, very interesting. Malignant hyperthermia can develop in people with genetically defected in synaptic membrane, for example, defect of the ryanodine receptor. When the patient is given muscle relaxant, a lot of calcium is released from the endoplasmatic reticulum, increasing muscle contraction, and energy consumption increases, and oxygen deficiency a lot, and form a lot less lactic acid or acid element, pH change, and form acidosis, pH is decreasing, and ATP broke down, ATP depleted, glycogenolysis is increasing, anabolic metabolism is increasing, and in acidosis the blood vessel is dilation. In the dilation, drop in blood pressure, and cellular loss of potassium from hyperkalemia. In the hyperkalemia, develop of failure of heart system, and arrhythmia develop, and heat production increasing, and temperature regulation is impairing, and may the organism lose consciousness, maybe form coma. Significance of a fever: stimulated the immune response, activated the function of phagocyte cell, activated enzyme then inhibit viral replication and decreasing resistance of microorganism to drugs element, increasing barrier and antioxidant function of liver, and pyrotherapy. What does it mean, pyrotherapy? Pyrotherapy type of treatment of virus disease by means of artificially decreasing fever or overheating. And pyrotherapy take part in diseases of skin and neurosyphilis and etc. Complication of fever dependent on the age. In early childhood, between 6 and 12 months, and contractile mechanism of thermogenesis. Thermogenesis is process occur in the stadium incremente, may lead to the development of febrile seizures and including respiratory muscles and severe hypoxia. In old age, a critical decrease of body temperature, and this process develop in stadium decremente on the background of atherosclerotic change of the vascular wall, decreasing its elasticity. Vasodilation may lead to collapse. Thank you for attention and take care.